3.
Hi, I'm Donna Rigsby. I'm a registered nurse. I'm going to do a skin assessment on you today. Actually, a head to toe assessment on you. We're going to start with the skin. We're going to look your skin over today from head to toe, and we're going to look for any abnormalities. We're going to look for the color, the texture, for any raised areas, skin tags, which usually are known to be around the neck area here, or sometimes around the breast area. Sometimes they can be under the arm, behind the arm, and the armpits. You do have a few, but not very big in nature. We're going to look for scars and bruising. We're going to look for warts, any abnormalities in the borders of a wart or the moles, any darkened moles with edges that are not round. We're going to look for edema, especially in the lower extremities. Sometimes that's a signal of other disease processes such as the heart. We're going to look and make sure that you have elasticity in your skin. You're going to raise up the skin here for 3 seconds and it goes back down so you're well hydrated. So your skin looks pretty good, it's smooth. It does show just normal ages of, normal signs of aging. We're going to move on to your eyes. We're going to look to make sure that your eyes are symmetrical across the front of your face in line with the tops of your ears. We're going to look and make sure that you can see and follow in and out. This is the 6 cardinals signs of vision. We're going to look at the conjunctiva down here in the lower eye to make sure that it's not red. There's no vested or bursted blood vessels. We're going to look for the roundness of your eyeball and the sclera. The sclera is white as it should be. Normally a discolored sclera and color of a yellow would indicate jaundice. A normal eyeball will constrict and dilate with the penetration of a pin light. We're going to look at your eyebrows to make sure that the hair distribution is even, and as well as your hair up above to make sure that the hair distribution is even and your scalp is not dry. It's got the regular amount of oil needed for you. We're going to look at your ears next, and again we're going to do the same thing with your ears. We're going to make sure that they are symmetrically even across with your eyes. The thickness of the lobe of your ears, we're going to look at the pinna of the ear. When assessing the ear, you use an otoscope, and you can put the otoscope, the head of the otoscope into your ear and look down into the ear canal, into the eardrum. And by doing that, you would pull up and back to make sure. The otoscope also will look for any exudate or discharge and or the buildup of wax in your ear. There's various hearing tests that you can have performed on you. The Rhine test is one of them that's very popular as well. It determines hearing within your ears. Next, we're going to go on to your nose and your sinuses and your throat. You can open your mouth for me, please. We're going to check to make sure that there's no lesions, no abnormalities, open areas. It's nice and moist and pink. Your uvula is dropped down into the middle of your throat back there. Your tongue you can lift up and side to side, pull out, yes, and that's great. You have good saliva production in there. We're going to check to make sure that your sinus is in your nose. You can close one side of your nose for me, and you can take a deep breath, and then you can do the other one, and that makes sure that there's no obstruction in your nose. We're going to make sure that we can assess the throat as well. We can see that the Adam's apple is in midline here in the throat. Over here we have a carotid artery. We can palpate the artery for fluid volume. You can also auscultate the artery, the carotid artery, for a bruit, and that is auscultatable. The bruit is also there. We're going to go on down to the respiratory system, which is the lungs. We're going to auscultate lung sounds. We're going to look for on inspection. We're going to look and make sure that when you take a deep breath, your chest expands and then it goes back down. We're going to listen for chest sounds, lung sounds. We're moving side to side with the lung sounds, symmetrically straight across this way, just to make sure. We do it also on the back. You do each area for 1 full minute to make sure, and moving down and then across diagonally for each of the long sounds. Can I ask you to cough, please? Okay, and then we're going to look at the back to make sure if the spine is in line. I'm going to feel the spine, make sure that there is no abnormalities, no bulges. Going to check off the thoracic part up here, and it all seems to be fine. Okay, we're now going to move down to your cardiovascular or your heart. We're going to listen to your heart sounds. We're going to listen over into the aortic and the pulmonic, the tricuspid and the apex. We're going to listen for each minute using the bell and the diaphragm. Do the same as you would for breath sounds, moving down across. You can also palpate the heart right here at the apex of the heart. You can look at the fingernails for clubbing. You can check the capillary reflex for 3 seconds to make sure that it goes back to a normal nice pink color, to make sure that your circulation to your lower extremities are being replenished with the right amount of blood. We listen to your heart sounds. We listen for the S1 and the S2, which is the normal heart sounds. The S3 and the S4 are the abnormal heart sounds. It is a gallop, and there are abnormalities. We're going to look at the chest as well to make sure that it's not a sunken chest, or make sure that you don't have a rounded chest or chest bone here, breastbone, which would be a pigeon chest. The neurological system, we can ask you what your name is, and if you know the date and the time. That tells me that you are cognitively intact. Your balance and your gait, your coordination of movements is all part of the neurological system. The ability to grasp hands and squeeze equally on both sides, test that. Okay. Moving down to the GI system, which is in your stomach, you have your small intestines and your large intestines. Food starts through your mouth as mastication. It goes down your throat and into your stomach. So the GI system actually starts in your mouth with the breakdown of foods, and it goes into your system here. You're going to look for visual asymmetry, roundness. You can listen for vowel sounds. You can also listen for the back, into your back for vowel sounds into the lower back, and even the kidneys are back there as well. Your abdominal area is soft. I did hear active vowel sounds. There's no distinction. You can also percuss into your stomach over dull areas, and that is indicative of fluid sometimes. We're going to move on to the next system, which is the male reproductive system. We're not going to do a visual or an exam at this point, but you would look for your testes to make sure that your testicles are encapsulated and that they have dropped down. There's no bulging, there's no abnormalities. You're going to look at your penis to make sure that the foreskin can retract and back and forth. If you're having any trouble urinating, burning, if you've got any open lesions on your testicles. And the last one that we're going to go through is the musculoskeletal. We're going to make sure that the coordination of your body, there's no swelling, your gait, you're able to have a reflex. You should be able to hit here. Just the reflexes in your body, the range of motion, to make sure that all extremities, they might ask you to get up and walk to make sure that your balance is fine. That is the head to toe assessment. Thank you.